The miracle of birth is about to happen.
We're getting down to the uterus. Now we'll make our uterine incision.
It's a moment that will last for a lifetime.
Push harder, 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 right on your bottom. Now come on, one more time. Again, ready?
But before it arrives, 5 women will experience fear,
I can't do it, no.
anxiety,
That scar could open up and that could cause the baby to die.
and pain. It will be a time for life and death decisions. The moment of birth will depend on caring hands. At Mercy Medical Center in Baltimore, Antoanette Hurd is about to hear her unborn son's heartbeat.
You can go right in one.
And she's worried.
Baby moving every hour? Every hour. Okay.
During a routine checkup 2 months ago, it was discovered that he has a life-threatening heart problem.
They checked the fetal heart rate, and she said his heart rate was high, which was in the 240s. She called Mercy and let them know I was coming over because she wanted to have me monitored. I ended up staying for almost 2 weeks. They had just started me on Induction, which is the medicine that I take now.
The Digoxin slowed her baby's heart rate, but Antoanette could suffer serious side effects because of the medicine.
I immediately started crying because I didn't know what was going on. I didn't know how I was going to react to the medication because I've never had, any type of heart problem or anything. It was scary.
We're gonna look at the baby's heart.
3 times a week, Antoanette comes in for a non-stress test and a biophysical, a test that checks the baby's movement.
No problem.
Today, something is wrong.
This is different, it's not too high or too low like it was. It just sounds like it's almost skipping a beat. So we're gonna look at Ian's heart, see if we can figure out if it's skipping a beat.
An hour later, an ultrasound indicates more problems. The baby is underweight for 38 weeks. The blood flow is low, and his breathing is off.
Well, today we heard the arrhythmia again, which we haven't heard in, I guess, about, 4 or 5 weeks?
Miss Antoinette had a couple issues today.
Time is no longer on baby Ian's side.
I told her I didn't think that we should wait till Friday to get her delivered.
Antoanette must deliver as soon as possible.
We'll start the induction within the next 24 hours.
Nervous. I'm very nervous now. I was anxious to get him out before I got here, and now I'm nervous.
What I want to do is actually take a look at your cervix. All right, is that all right? Okay, I think you're starting to dilate a little bit. Okay, can you roll back onto your back? I'm gonna leave you alone.
When Delmarine Coles Atkinson and her husband Howard decided to have a baby,
Okay, I just want to take a look, okay?
they knew the odds were against them.
Oh. Just hold my hand, squeeze my hand.
Delmarine suffers from lupus,
Good.
a hereditary disease that can turn deadly, especially during childbirth.
My mom also has systemic lupus. She just passed away September the 16th of last year, and she had a lot of complications when she had me. And my concerns are, am I gonna have the same complications she had?
Oh, God. Oh, God.
The complications my mom had were seizure, and she had to end up having an emergency C-section. And after her C-section, she had a lupus attack, which attacked her heart.
Oh, God. Oh, God. No, stop.
For the past 2 weeks, the lupus has been flaring up,
I can't do it. No.
You can do it. You can do it.
endangering both Delmarine and her baby.
3 centimeters. 3 centimeters, girl. I'm gonna throw up.
Your body makes antibodies to itself. It makes components of the blood that actually attack other organs. So it can attack your joints, it can attack your skin. And with lupus, which is one of the more common autoimmune diseases, it can attack any organ in the body.
Oh, come on now. Come on, you can do it.
Okay, there we go. All right.
48 hours ago, Del Marine checked into Mercy to be induced, despite the fact that she is only at 36 weeks.
Yes, you did. Yes, you did.
She's completely dilated. Okay.
Oh, Jesus.
Okay, all right. You did good, okay? I think your cervix is just a little kind of closed up. You're about 3 centimeters, okay? Your cervix is all the way softened out. That's completely faced, okay?
Almost there. Almost there, girl.
Okay, all right.
Mercy has the lowest infant mortality rate in the state, but that is little consolation to Howard Atkinson.
You okay? You okay?
No, why don't you sit down?
Right now, his wife and baby are in danger.
Lift this leg a little bit closer to you.
Straddle that or?
Okay. You're gonna feel my touch, and then you're gonna feel lots of pressure.
Debbie Wagner is pregnant with her 3rd baby, preparing to deliver, something that has never been easy for her to do.
I had a lot of contractions over the past week, and last night had a lot. We were timing them probably between
7 and 12 minutes.
7 and 12 minutes apart, and a lot of pressure with some of them.
So you're gonna feel lots of pressure.
Debbie has been in labor for 8 hours. Based on past experience, she's afraid of what could happen next.
Okay, so it's clear fluid. Okay. So you'll just continue to feel leakage, and this is gonna help bring these contractions actually closer together and make them stronger.
Hello. Are you more comfy now?
Oh, yeah.
Good. How about I check you?
Okay.
We'll see if anything's happening. And actually, I want to stick a monitor on the inside. Remember
Okay.
with the C-section, you have that scar. We said we didn't want to use Pitocin, but we needed to, so I want to put a monitor in to make sure we're not making you contract too hard.
Okay.
Debbie's first baby was breech and had to be delivered via C-section.
How dilated am I?
You're like 5.
Oh, I'll take it.
4 years later, her daughter's birth was also difficult.
The vaginal delivery with my 2nd child was a little rough. I had a hard time dilating, and they induced labor, and labor lasted about 26 hours.
Debbie's doctor is concerned about the dangers of another difficult labor.
She's had a C-section with her first child, and there's a scar on her uterus. We don't want to make her contract too hard and potentially cause that scar to open up, because then it becomes an emergency that requires a C-section again. And it's just not a good thing to happen. If you start feeling more pressure, like things are progressing, they'll check you and give me a call, but I am like
Okay.
4 minutes away.
Alrighty.
Okay?
I'll wait for you, I promise.
Yes, don't do anything drastic without me. I'll be back.
Okay.
We started her on Pitocin to get the contractions more frequent and stronger to dilate her cervix so that we can have this baby today.
It's just amazing the difference the Pitocin makes and how quickly it worked.
The contractions are about 2 to 3 minutes apart.
The contractions are getting more intense. Debbie's C-section scar could rupture at any moment.
Where are you?
Jody Tomorrow's baby is in trouble. When Jody was 23 weeks pregnant, she and her husband Tony found out her delivery would be anything but normal.
Hi, Jody. How are you doing this
Good.
morning?
How are you?
Good. We're going to attempt the version. We're going to be doing an ultrasound to monitor the baby, the position, and so forth during the procedure. And if there are any problems, we'll stop at that time.
In the 23rd or 24th week, we found out that the baby was breech, and it hasn't turned, so today we're scheduled for a version, which means that they're going to try to manually turn the baby outside.
So now what we're going to do...
If Jody is to deliver this baby vaginally, turning it around is the only option. Otherwise, an attempt at a normal birth could kill her baby.
Well, one of the concerns is that after delivery of the fetal body, the fetal head could get entrapped, and you may have difficulty getting the fetal head out. So right now, using the ultrasound machine, we're confirming the presentation of the baby, where the back is, where the fetal parts are, what type of breech we're dealing with.
I need to get a good grip of the skin there.
You grip away.
The aversion is a delicate procedure. and the chances of it succeeding are less than 50-50. Done improperly, it could compress the umbilical cord, cutting off the baby's oxygen supply.
I'm trying to push the buttocks of the baby towards the left side of the mother because it's already a little bit oblique. The buttocks are here, and I'm trying to bring the head down at the same time. The baby is a good-sized baby, and pushing the buttocks in that direction.
If you're feeling a lot of discomfort, you need to let us know.
Yeah, it's very uncomfortable.
I know that I'm putting a lot of pressure there.
The longer it takes, the greater the risk.
A little less uncomfortable.
Jody's uterus could rupture, and the baby could go into distress.
It looks pretty painful. If it works, I mean, I'm happy. But if it's too much pain, I'd expect her to just stop and go with the cesarean.
It's unbelievable amount of pressure.
I'm going to try the other direction because going in the direction that we supposed that was going to move is not moving more than maybe 15 degrees.
The buttocks of the baby is still down in the pelvis, so I'm pushing up on it. Maybe that'll help.
Okay. We're trying to work from below and from above by pushing the presenting part, that is the buttocks, a little bit higher. That might facilitate the version.
The prolonged effort is starting to take its toll on Jody.
That's a girl.
If the baby doesn't turn soon, the doctors will be forced to give up.
I love you. I love a baby.
Feeling them again?
Yeah.
Okay. Leg holders, get ready.
Okay. Feel pressure?
Ooh, it's right there.
The baby.
Okay, uh-huh.
Oh, hold on.
Hold on.
She's
Get
gonna
one.
pop out.
Debbie's contractions are getting stronger.
And push, Deb, come on. Push, 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 push. Come on. Pull your legs back and push.
Dr. Hoffman is worried that her C-section scar could rupture and put the baby in danger.
Blow it out. Come on.
Hair? Can you see her hair?
Here's dark.
It's been almost 6 hours since Debbie started taking Pitocin.
Breath, Deb, and push. Come on. Get this big. That's it. Here she comes. Push, 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 Deb. Come on. Push harder. Harder, harder. Right up your bottom. Okay, blow it out. Now, come on. One more time. Do it again. You press in and get this baby. She's right here. Here she comes. Here she comes. Come on. Push.
I see her, babe.
Just relax. Relax.
You got a little one here.
Shoulder.
Yeah, I mean,
Moving. Okay, yes, you can. Look, Deb. Here she comes.
Oh, she's a perfect size. Oh my God. How you doing, Mom?
I'm gonna cover.
I'm loving it. Oh, she's precious. Right, hello, baby. Hello, baby. Oh, sweetheart.
Give me an essay, John.
No, I don't want the picture.
Beautiful.
This one is for the contractions.
Anita and Sean Heron never thought they would have a child of their own.
I never thought I'd be in this situation, ever. Even after 9 months, still shocked. Like, when she moves, I'm still like, you know, oh, there's a baby in there. Wow, that's so neat.
And your due date is when?
The 15th of May.
They battled infertility for years before finally deciding to adopt. Then came a bittersweet surprise.
I got pregnant. We were very surprised. Unfortunately, we lost that baby in July, but then I became pregnant again in August, and that's why we're here.
Right on target.
I was gonna say, that's where they picked up her heartbeat the other day.
Now 39 weeks pregnant, Anita is hoping for a happy ending, but she knows that something could go wrong.
Okay, and the time, please.
I am at high risk for having to have a C-section. We're hoping that won't happen. I'm hoping to be able to deliver vaginally, but I am high risk for that. And with my age, I'm 36, So once you hit that 35-year mark, there's always a little bit of a risk.
Baby's heart rate is fine. It's a little high, but
I'm looking forward to being done. I don't know that I'm looking forward to the process that we're about to go through.
They decided to induce me because the size of my pelvis is small and the baby is growing. She's big, you know, because she's healthy. She weighs between 6.5 and 7 pounds. And it was important for me and to, you know, have a vaginal birth. And in order to do that, she needs to come out real soon. Legs out to the side.
But there's another problem. In 2001, Anita had surgery to remove fibroid cysts from her uterus. The scar could endanger the delivery.
Say you're about 1 centimeter dilated, and cervix about 50% effaced.
You can't get 2 in there?
Not 2 fingers, no. I mean, she's a very easy one. I would say like 1.5.
There's a 10% chance that that scar could open up and then the baby would come out of the uterus, not out of the stomach, out of, you know, through the skin, and that could cause the baby to die and could risk a hysterectomy for the woman.
Looks like you are having some irregular uterine activity. You might not be feeling the contractions, but...
The baby looks nice and reactive. If you actually want to get up and walk around, that would be great. They'll come back in about an hour and recheck you.
Antoinette's due date is still a week away,
your date of birth?
but her doctor wants her checked into the hospital immediately.
Dr. Scholes is your doctor? Your regular? No, Dr. Honey. Dr. Honey.
Her baby is showing early signs of distress.
There you go. You can hear him good. This is for contractions.
Antoinette's baby has an accelerated heartbeat called an atrial flutter.
You want me to go lay on my side now?
Yeah. That just gives the baby a little bit more oxygen.
A potentially serious problem that could jeopardize a safe delivery.
What if it takes 3 days?
She didn't say 3 days, she said 2 days.
2 to 3, that could be 3 days.
It won't be that long. It won't be that long. We can bet on it.
You hope?
It's not going to be that long.
Okay. You nervous?
Yeah.
Me too.
Pain? I'm not looking forward to the pain. I'm just not ready for it. But I don't have a choice, so.
You tough, you can handle it.
Yeah, okay.
Okay, you're gonna get the baby out in just a minute, okay?
Del Marine has been in the hospital for 2 days and in labor for 26 hours.
We are gonna be calling the nursery staff, okay, because you do have that fever. Your temperature is 102 and the baby's heart rate's a little fast.
She is running a fever, which indicates her lupus could be flaring up. Del Marine's disease is putting her baby at risk. It is imperative that she deliver the baby now.
Just go ahead and
All right.
okay. Okay, take your breath in and push down, okay? You pushing? That's it. Good. Good.
She's coming.
5, 6,
She's coming. 8, 9, 10. Take a breath. Breathe out.
Del Marine has to take a break before she can push again.
All right. Okay, a little bit. All right. You want to go ahead and give us a good push. Here we go.
Good job.
Nice. Push, 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 push. Oh. All right. There she is.
Oh. 426. Did it, girl.
All right.
Good job, Delivery.
All right. Yeah. Okay. We want to try first a little bit. Okay. Here we go. All right.
Oh, yeah.
Good girl.
It's all over, right? Okay. Just gonna wait for this part. You don't have to do anything.
Is her head okay?
Yeah, shaking because of the way she was inside. 3 days you won't even know.
Yeah.
Right.
There you go.
The baby's airways are cleared, but she still needs an extra blast of oxygen.
Happy birthday, darling.
This is the first time I've ever been in the delivery room. I didn't even see my daughter when she was born. That was out. This is amazing. Yes.
Say happy birthday to me. Yeah.
Her lungs might be a little immature. She's staying fine without oxygen. She's nice and pink. But the fact that she's breathing fast, I'm going to send her to the regular nursery. She has about an hour or two, and if she doesn't resolve this by then she'll need to come to intensive care nursery and later. But we'll let you hold her and all before we take her on down.
How you doing? There you go. Just a little bit higher with your hand. Get her neck. There you go.
You got my chin. You got mommy's chin.
Yeah, she got here and talked to Louis today. How about that?
Give me a kiss, Mom.
The baby's delicate condition means she will have to be watched very closely.
Later.
Because she had temperature, they'll have to draw blood from the baby to make sure there's no infection. That's sometimes a risk for infection. So they're going to look for that in the baby, too.
Del Marine tries to think only positive thoughts.
The angel belonged to my mom who just passed away. She just helped me, like, you know, everything's gonna be okay.
Jody's doctors are still trying to turn her baby around so she can avoid the pain of a C-section. But right now, the chances are slim.
Yeah, the headache came back. I think we should not continue.
The size and position of the baby make it impossible to continue without endangering both mother and child.
We could continue to make more efforts, but
No,
I think,
that's-
to my judgment, I think we did enough. It's unfortunate we didn't succeed, but
At least we said it was
we
right.
don't want to begin to produce separation of the placenta and get in trouble with the baby either.
Right. Yeah, but I'd rather have a healthy baby than the alternative, obviously. So whatever happens, happens.
As long as mom and baby are healthy. I mean, I was a little leery about the whole thing to begin with. I mean, the baby's in that position for so long, and just trying to turn it. You know, it was meant to happen that way, so that's what we're doing, having a cesarean now.
Anita is walking the halls with her husband Sean for the last time.
I needed to get up and move around a little bit, though. It's getting kind of cramped in the bed, especially when I found out I was going to be there for a long time, here pretty soon. I don't feel contractions, no, not yet. I'm antsy, though, so maybe I'll have an easy labor. Can only hope.
The odds against an easy labor are high. Anita's small 5-foot frame, combined with the scars on her uterus, are cause for considerable concern.
So I spoke to Dr. Brownhole, and so what we're going to do is we're going to try to break your back with water, and then what we'll do is we'll slowly start you on Pitocin. Just because you've had that prior surgery on your uterus, you know, you have a higher chance of rupturing it, so we're going to do everything very carefully.
Okay, go ahead, can you lift your bottom? There you go.
More that can come through the wrist. She's pretty effaced. She's 90% effaced. The baby's head is low at 0.
So we have made some progress doing that walk.
Yeah, baby's head is down, so just kind of tear a little hole inside the amniotic sac. Let's just...
Sean thinks Anita's amniotic sac already ruptured.
I mean, she did have a discharge. It wasn't much, but it wasn't real bloody. I mean, she's been bloody, and then this was not quite so bloody, but a lot more stuff came.
We'll start the Pitocin, and what I'll do is when I recheck you, we'll see if there's sac. My thought is it's just that there's no fluid coming back, and that your sac has either been ruptured or I just ruptured it. Might not. The head is really applied low, so there just might be a whole bunch of fluid behind the baby's head. Okay? Okay.
What we do is we start off at a real low dose. And like every half an hour, just come in and bump it up.
The hardest part for Anita and Sean is waiting and not knowing what might happen next. At Mercy Medical Center in Baltimore, Antoinette's baby is in trouble. Her heart is beating erratically.
The heart rate looks like it's going down a little bit. She's having a deceleration down. So you see how much slower it sounds? That's not the arrhythmia right now. That's the baby's heart rate going down. Did you just have a contraction?
Mm-hmm.
She's gonna put some oxygen on you.
It's gonna smell a little funny. It's plasticky. That just gives the baby a little bit more oxygen, okay? You can adjust it.
Because her contractions are more intense and closer together, it could be restricting blood flow to the placenta, making it difficult for the baby to breathe.
Well, we don't know why babies have these arrhythmias. It's unknown. The etiology is unknown. There's some babies just, for reasons, completely unbeknownst to us, they have them. Sometimes there's a structural abnormality that will cause the arrhythmia, but usually it's reasons we just don't know why. I'm gonna go ahead and rupture you because you definitely are dilated enough, okay? I know it's a little uncomfortable.
Don't hold your breath. Breathe in.
Because if it's clear, then, okay, I'm sorry.
Okay, sweetie.
Yeah, you were having a contraction. All right. Okay, good.
Good and
so the
clear.
amniotic fluid is clear.
An internal monitor will let doctors know the minute the baby's heartbeat becomes irregular.
This is a fetal scalp electrode, all right? So this small little thing is gonna go on the baby's scalp. It's gonna measure the heart rate a little bit better. Kind of bear down for me a little bit. She's just gonna help push him down because he's kind of high, and that's what's making this a little more difficult to apply. We don't.
I'm sorry, sweetie.
I know.
Sorry.
All right, this is definitely on the head. We're looking for any signs of abnormal heart rate and any signs that he may be going into heart failure.
Our goals every 2 to 3 minutes, each one lasting 60 seconds. So we can have a baby today.
7 hours into labor, Anita Herron's contractions are getting more intense. Her dream of giving birth after struggling with infertility is about to be realized.
My contractions started on their own, and ever since I've been restless and sore. I mean, they hurt. They hurt. Makes it hard to sleep, makes it hard to get up and walk around, so I'm uncomfortable. I say I'm okay, and that's usually between the contractions. It's not so bad, but when the contractions hit, they're a very new experience for me, and they hurt.
I think the cervical exam kind of irritated her uterus, so now she's contracting every 2 minutes. So I'm gonna wait and see if they start to space out and then start the Pitocin. Since she has had previous uterine surgery, I don't wanna overdo her uterus.
Anita is having trouble breathing through the pain.
You let me know if your contractions get too painful, and if you want something, and I can call Dr. Brownholt and see. Okay?
Oh, God. Oh.
Jody's hopes for a vaginal delivery have vanished.
We attempted the external version on the baby. It was unsuccessful because the baby did not turn easily. So we're going to do a cesarean section because that would be the safest thing for the baby.
Medicine should start to work fairly soon. Your chest will feel also kind of heavy. Okay, that's from my medicine also.
Feet right. And you want to touch anything, you can hold her hand like under the bowl, okay? Karen, can me to hold the book? A little cute book.
My arms are just so tingly. You know what was worst part? The lidocaine or whatever they put in the nose. The rest of it was okay.
Okay, can we get a large retractor, large rich?
Dr. Hunley is doing the type of C-section that will allow Jody to deliver vaginally in the future.
So far, everything is completely normal. We're getting down to the uterus. You okay, sweetie? And now we'll make our uterine incision in the lower uterine segment. Go down to the membranes, the amniotic sac. We're going to rupture those membranes. Nice clear fluid. Got a baby's butt right there. And we have the butt coming out. It's a little boy. Little Blake. Welcome to the world. And there he is. He's a handful.
Well, everybody was right. They said it was a boy, so I'm very happy.
Everything went real well. It's going to close you up.
You might have a chance to do a liposuction while you're at it, did you?
What'd you say? Liposuction. How many times have I been asked that?
9-1. 814.6. Almost 9 pounds, Blake. Keep it on till he's home with you.
But the joy of birth is suddenly overshadowed. Something is wrong. Baby Blake is turning blue.
That's to help to loosen up secretions, to help clear his lungs. Just has some extra secretions, and we had to give him some blow-by O2 initially. And when we tried the trial of room air, he started to turn dusky again, so we gave him back the O2, and we're going to suction him again.
The baby's oxygen supply had been temporarily cut off because of extra secretions in his airways. After being suctioned a second time, baby Blake responds by turning pink.
He's extreme.
Everything is going great. It is. We're closing the uterus at this point, and then we'll be closing the skin.
Follow the footprint.
Get used to that sound, Jody.
Oh, no.
Jody.
Who's that?
Susie's like,
You're gonna go see your mama.
Say hi to Mama.
Hey, Peanut.
He's a cutie.
He's very cutie.
Isn't he cute?
Is he too much?
He's adorable. He is. He's too cute.
He's perfect. Hey, buddy. Blake.
Anita is almost ready to start pushing,
Pick up the contractions, just lay there.
but she's having a hard time dealing with the pain.
Has it passed?
Okay.
Did you want me to give me something for pain?
We gave you something through your IV.
It still hurts so bad.
I know. Well, your contractions have gotten a lot stronger. The epidural was in the back of her mind.
I will take that.
You
if
will?
I can get it now.
You will?
I think it's a good idea because you're pretty dilated and baby's head is low, so maybe we can go a little faster. So this is a good time.
Okay.
Okay?
Okay.
So we'll talk to the anesthesiologist and see if they can set that up.
Okay, thank you.
Okay, I'll go page him.
All right.
Feeling sleepy? Well, if you're comfortable, go ahead and rest because you're going to need your energy for pushing.
The umbilical cord is a baby's lifeline.
Okay. You might feel a little bit of pressure.
But for Antoinette's baby, the cord is in danger of being crushed, cutting off the baby's nourishment and oxygen.
The baby's having some what we call variable decelerations, which means that the cord may be getting compressed because there's not enough fluid in there, amniotic fluid. So what we're going to do is we're going to infuse some fluid into the uterine cavity to buffer the cord so the cord doesn't get compressed. And hopefully the variable decelerations will go away.
Minutes after the infusion, the baby appears to be responding, but he's not in the clear yet.
It's infusing now? Yeah. Okay, good. Because if Antoinette hadn't come in, when she did, the baby potentially could have gone into congestive heart failure and potentially died. So it's really great that she was getting routine prenatal visits.
I'm just a little nervous, anxious to see the baby, but I see everybody's taking real good care of her. So I'm just staying out the way, letting them do what they do best.
They've been doing a pretty good job with her so far, and
a lot of attention, so every time something happens, you have a lot of doctors right around, so I'm really not too concerned.
We need to get the baby out in the next contraction or two, or I'm going to have to help you, okay?
Okay. She's right there.
She's right there.
A little more work.
After pushing for more than an hour, Anita needs a little help getting the baby's head out.
So she can do a little episiotomy, or you can push a little longer. I think a little one, you get the head out.
Yes.
The baby is starting to show signs of distress.
We take scissors and cut through the peritoneal body, which then opens up the space to allow the baby's head out. Some doctors do them routinely. Other ones, we've been stretching and working with her, but right now with the heartbeat dipping down, I'd rather just get the baby out sooner rather than, she could probably push another 15 or 20 minutes and get through it. But you get one, okay, come on, deep breath in and big push.
Good job.
There we go, here she comes, come on, push, Anita.
Push, push, push. Oh, she's
There
out.
we go, there's her head, Anita, look in the mirror. There's her head.
Oh my goodness. Oh, she's trying to open her eyes.
Yeah, she is. Another deep breath in and a big push.
Push.
Another hand. Look at her hand. She's waving. Push, Anita.
Push, push.
Okay, push again. You gotta move your hand. Push again.
Push,
There we go.
push,
That's her
push.
shoulder. Now again.
Push, push, darling. Oh, push, darling. Push, 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 baby. Oh, she.
Baby, what? Lord is a girl.
Show me what.
Right there.
There?
Yep, go ahead. That's it. Come on. Okay, just drop.
It's okay, you see me after all that hard work.
Yes. Sticky baby.
Oh, look at her feet.
Say hi, bye-bye. 6 pounds, 7.2 ounces.
You like them eyes open? You want to see what's going on? Do you recognize my voice? I've been talking to you.
It's been truly a miracle. I'm still stunned, you know, especially when I look over at her. I think, I still can't believe she's mine.
Take a nice deep breath in. Put your chin to your chest and push. 2, 3.
15 minutes after getting an epidural, Antoinette has the urge to push.
9 and 10.
Doctors don't know if her baby's heart problem will improve or worsen once he's outside the womb.
And deep breath in, push hard.
Anything could happen.
Great, you're doing great.
A nurse alerts the neonatal unit. A newborn, possibly critical, will soon be on the way.
We're doing a delivery 16.
You're doing great, you're doing great, Antoinette. 7, 8, 9,
Okay, thanks.
10. What a good pusher you are.
You're doing it. The head's right there. You feel it.
Fabulous. You're doing great. Another couple of pushes and we'll have a baby. We sure will.
She was doing a little flaring and retracting, so that's why we brought her down here.
Well, hopefully she will continue to breathe like she is right now. Not too fast, no nasal flaring. And after a couple of hours, they'll send her back to mom to breastfeed.
Del Marine's baby girl is being monitored in the nursery. Del Marine was running a fever of 102 when Jalen was born, and there may be complications due to her lupus.
If she continues to show signs of respiratory distress, then we'll take her upstairs and start an IV and draw blood cultures and give her whatever kind of oxygen support she needs from there. But she seems to have settled down right well. And this is the temperature we want her at and the temperature she currently is at. And the bed will give out enough heat to bring her up. Right now she's cold, so it's going to tell me.
3 hours after giving birth, Del Marine's fever has broken, and she gets to see little Jalen again.
I was just glad to see that she was okay after they checked her out. Her heart was beating a little fast because of me having a fever. I had a high fever that I didn't know that I had. She looks like me. Yeah, I'm just happy she's here and she's healthy. That was my biggest concern with my illness, that she came out healthy. Ooh, you like attention.
Isn't she beautiful?
The newest member of the Downey family is on her way to meet her siblings.
She's beautiful.
It was a whole lot different than the second one where I was in labor for 26 hours. Once they gave me the epidural, it was a breeze. Just everybody was wonderful. It's been an incredible experience.
I have 2 little sisters. I have nothing to say.
Now you have 3. You excited about it?
Yes.
Yeah? What about when she cries in the middle of the night?
She's gonna wake me up and I'm gonna get really mad.
I don't think so. You have to learn how to change diapers.
Ew!
That one more doesn't really make that much of a difference. It's kind of nice. Starting all over again.
Take a deep breath. Deep breath in.
Antoinette has been in labor for 9 hours.
Push. 2, 3, 4.
The longer it takes for her to deliver, the more strain it puts on her baby's heart.
9 and 10. Take a quick deep breath. One more time. One more time. Pull your lungs up. Pull your legs back. Put your chin to your chest. Right there. Push. On your bottom. 2. Good. Good. Here he is. Here he comes. Oh, he's crying. Comes out screaming. There he is. Happy birthday. Happy birthday, baby.
Participating in the delivery here.
There he is. There he is. And he does have more hair than mine.
Congratulations.
Beautiful. All that hard work.
The plumbing works. Yeah, you got me, you sucker. You got me. And they kissed him on the...
He is just adorable. So you know they're going to take him up to the neonatal intensive care unit and they'll monitor him and probably keep him on the digoxin, do the echocardiogram and evaluate him up there.
You should hold him. Look at Dad. You can do it.
What's up, buddy? Hey, man. Happy birthday.
Baby Ian's heart condition is still a threat.
You hear me singing to you all those days?
Now that he's outside the womb, a cardiologist will decide what to do next.
Yeah. We're gonna go ahead and take him up so they can get him on the monitor.
Get him back to you as soon as we can. Tell Mama and Daddy bye-bye. Say I'll see you soon.
Bye, Ian.
At Mercy Medical Center in Baltimore, Antoinette's baby is now the focus of urgent concern. A battery of tests will determine if he needs to undergo emergency heart surgery.
We're going to do a 12-lead EKG on him because of his arrhythmias.
It's just gonna look and see if he has any arrhythmias. It measures electrical activity in the heart.
3 hours later, a team of cardiologists goes over the results and decides more tests are needed.
Overall, the function looks good. There's no...
The rate looks good.
Yeah, his EKG is normal. You know, we interrogate everything, how the veins come to the heart, how the blood goes into the heart, and how it leaves the heart. So right now I'm looking at his aortic arch, which is the major artery that leads the blood from the heart to the body. This is his left ventricle, this is his aortic valve, and this is his left atrium, the mitral valve, so we can see the left-sided structure of his heart, and they all appear normal.
For now, baby Ian will be kept on heart medication. It will prevent his heart from beating too fast.
What I'm going to do is probably keep him on his digoxin sort of start him on a dose that's appropriate for his age, and use that for a short period, maybe a month or two. If he does not show any signs of arrhythmia, then stop the digoxin and just wean him off and follow him periodically with that. Overall, he is excellent.
It's just still so hard to believe that.
But he's ours.
Yeah.
Baby Blake was born just 24 hours ago. To Jody and Tony, it feels like a lifetime.
No, woke up about every 45 minutes and kept Mom and Dad hopping.
For the first time since finding out her son was breech, Jody can relax and start to enjoy motherhood.
Yeah.
You know that we're going to be going home with him instead of fantasizing about going home with him.
Can you believe she was in my tummy yesterday?
Anita and Sean Heron couldn't wait to introduce their adopted sons to the newest member of the family.
Hi. Talk to her. She'll open her eyes.
Hey, Shauna. How you doing? Shauna, Mom.
No, she's a day old. One day. She recognizes your voice. Remember when she was in my belly and you would talk to her at home? When you talk to her now, she recognizes your voices. She has hair like your dad's. Look at that bald right there.
Giving birth was an experience Anita never thought she'd have.
Here we go. On our way.
Now, after 2 days in the hospital, she is taking her daughter home.
It's the van, the gold van.
I'm glad to be going home. Glad to be taking the baby home.
I started feeling pretty tired, and now full of energy.
Now you can tell how new we are.
Hi, how are you doing? Congratulations. He looks pretty good. His heart rate right now is normal. Okay. Anywhere between 130 and 150. His EKG is normal. I don't see any signs of any underlying problems electricity-wise.
I know I look a mess.
For the first time since finding out her baby had a heart condition, Antoanette is finally starting to relax.
Doctor says his heart looks fine, so that's good news. Hopefully he'll be okay once they take him off of the digoxin.
She did good. She did a good job. It was rough for a little while. I didn't get cursed out, so I guess that's a good job. The medicine helped.
I'm looking forward to taking him home. Looking forward to him being healthy. No problems with his heart, hopefully.
24 hours after giving birth, Ron and Antoanette finally get to visit Ian, the baby they call a miracle.
They're just going to monitor him this evening, but they're looking to let him go home tomorrow.
It's like a big relief, sign of joy, sun in the world. So I'm pretty happy right now.
Shauna, Ian, Jalen, Cora, and Blake. 5 babies who, despite different obstacles, came into this world via special delivery.